to look at 4 different first aid treatments for 4 different types of injuries. So the first one we're going to look at is stress fractures. So if you found someone with a stress fracture, you would apply the Price technique. So first of all, you would protect the area. You would rest the area. You would ice the area, but you wouldn't apply any compression because this could actually make the injury worse. And you would also elevate it. You would also give them some pain relief through the form of paracetamol, ibuprofen, or an equivalent. You would also have a visit to the hospital where they would x-ray, and you could potentially be put in a cast or a splint or a boot. You would be given some crutches, depending on depending on the area of the stress fracture. And also the area would be immobilized, potential surgery, and then following this you would have physiotherapy, and rehabilitation. The next injury we're going to look at is a dislocation. So the first thing you would do if you found someone with a dislocation is you would ring the emergency services, as only someone qualified is able to relocate a joint which has been dislocated, and this is because often nerves could be trapped if someone tries to put it in and they don't know how to, and this can cause even more pain and can actually make it even worse. Following this, they might have to have surgery to put it in properly, and depending on if it was their shoulder, they might be in a sling. However, you can offer them pain relief if you find them. Another injury is a sprain. So for a sprain, you would apply all of the 5 Price techniques. So you would protect the area, rest the area, ice the area, compress the area, and elevate the injury. So again, they'd probably go to a professional, and they could be, depending on the area, again, they could be given a splint or a cast. So they will also be offered physiotherapy, and they should avoid heat and movement because it could obviously make it even worse. They can also be offered pain relief, such as the paracetamol and ibuprofen. And with the compression, they will basically use a compression wrap to wrap up the sprain to decrease the inflammation. And then following this, they will be given strengthening exercises to restore the strength in the area. And the final injury we're going to look at is cramp. So the first thing you would do if you found someone with cramp is you would help them stretch the area gently, and you try and relax the muscle and get them out of the cramp. Also, heat is good, so you can do this with heat packs. Further treatments, so when they're recovering from the episode of cramp, is you would offer them water and rehydration drinks, because this is a factor which does cause cramp. As the same for electrolyte repletion, because that is another area where they would have lost their electrolyte levels, so that's why they would be more prone to cramp. And following this, they could also start taking calcium supplements. Also, they could take quinine, which is something which helps with cramp, and they could have a tonic water. Here I'm going to demonstrate what to do if you find someone in shock. So the first thing to look for is a pale colour in the skin. So what you're first going to do is you're going to elevate the legs so that more oxygen can get to the brain, because that's what hasn't been happening during shock. So you're just going to carefully place the legs on there, and also you want to make sure that they are kept warm until the emergency services arrive. So use jackets to keep them warm, and also carefully lift their head just to keep them comfy, but be careful of any injuries that they have. In this video I'm going to show the recovery position. This will be used when you find someone unconscious but breathing. If there's 2 people there, you'd use one to call for the emergency services, otherwise you'd do this first and then call. So the first thing is we move this hand up here, this hand across the face. You lift up this knee and you roll them over. This is so that if they are sick, then they won't choke on it.